Welcome to the Person-Centered and Behavioral Support Training, presented by Vagthal's Residential Care Center, Inc. This section of the training focuses on age-appropriate activities and supports. By the end of this training, staff will understand what age-appropriate means under HCBS. We will cover supporting residents in activities, clothing, outings, and entertainment that respect their dignity and adulthood while promoting choice and independence. The core HCBS principle is that adults with intellectual disabilities must be treated as adults. This requires person-centered choice, dignity and respect, full access to community life, and freedom from unnecessary restrictions. Appropriate activities include adult board games, exercise classes, cooking, and arts and crafts designed for adults. They should also include volunteer work and hobbies based on resident interests. Activities that are not appropriate include items like coloring books or baby puzzles meant for children, and forced group activities. The key rule is to ask, would this be appropriate for an adult without a disability? Age-appropriate clothing is chosen by the resident and is adult style, matching their age, culture, and preference. It should be appropriate for the weather and occasion and support self-expression. Inappropriate clothing includes children's clothing or matching outfits for all residents. Staff must assist with choice and offer options instead of controlling clothing for convenience or behavior management. Appropriate community outings and access include visiting restaurants, malls, movies, parks, sporting events, and social clubs. These should be individual or small group outings based on preference. Inappropriate outings include only going out as a group, limiting outings for staff convenience, or only visiting kid-friendly places. Residents must have the same access to the community as people without disabilities. For entertainment, appropriate choices include adult TV shows, movies, news, and music genres chosen by the resident. Allow residents control over streaming services and use individual headphones or room choices when possible. Do not play cartoons or children's shows by default, or let staff choose content based only on their preference. Best practice is to ask residents what they want to watch or listen to, and rotate choices fairly in shared spaces. Staff must offer real choices, respect refusals, and encourage independence. Support decision-making even if choices differ from staff preferences. Never use phrases like, "because that's the rule," or "they don't understand." Common HCBS violations include treating adults like children, using rigid group schedules, restricting personal items or activities, and using entertainment to manage behavior. Always ensure personal choice and privacy. Staff responsibilities include knowing each resident's person-centered plan, documenting preferences, and advocating for choice. Always report concerns if residents are being restricted or infantilized, and promote dignity. Consider this scenario. A 45-year-old resident wants to watch action movies, but staff prefer cartoons because it, quote, keeps everyone calm. The correct HCBS response is to respect the resident's preference. Offer alternatives for shared spaces, such as headphones, and document the choice. Remember, disability does not remove adulthood. The next section covers the importance of knowing the resident. An IPP, or Individual Program Plan, is a legally required, person-centered planning document. It outlines the resident's needs, goals, preferences, services, health and safety requirements, and behavioral supports. The IPP directs how staff must support the resident, ensuring individualized care, protecting rights, and guiding behavioral strategies. It is the resident's official care roadmap and is not optional. All staff must review the IPP before providing care and follow instructions exactly. You should use the IPP to guide daily routines and report changes, but never make unauthorized changes. Leadership must ensure staff have access to current IPPs and that they are updated when changes occur. They must also monitor staff compliance and reinforce IPP use through coaching. The IPP tells us who the resident is, what they need, and how to support them safely and respectfully. Following the IPP is a licensing and resident rights requirement. We now begin the behavioral support training. This section covers recognizing and understanding behaviors. We will look at common behaviors, triggers, and the significance of identifying underlying causes to develop effective support strategies. Residents may exhibit behaviors such as agitation, aggression, withdrawal, or repetitive actions. It is vital to remember these are signals, not intentional misbehavior, often communicating discomfort or unmet needs. Common triggers for behaviors include environmental factors like loud noise or changes in routine, medical conditions such as pain or fatigue, and unmet needs like difficulty communicating or feeling unsafe. Understanding behavior helps staff identify the underlying cause, allowing them to look for triggers and check the IPP. This enables the use of preventative strategies, reducing escalation and incidents for better outcomes. Proper understanding promotes a safe and supportive environment by reducing stress and supporting dignity. Behaviors are signals, not problems. When we understand the cause, we can respond safely and respectfully. Next, we will cover de-escalation techniques. These practical methods include staying calm, active listening, respecting personal space, and offering choices to maintain a supportive environment. The first technique is to stay calm. Your tone and body language matter. Speak slowly and softly, keep facial expressions neutral, and breathe. Residents often mirror staff emotions, and your calmness helps them feel safe. Second, use active listening to show the resident they are being heard. Listen without interrupting, acknowledge feelings, and use simple validation, for example, by saying, "I can see you're upset." Third, respect personal space. Crowding can increase agitation. Stand at a safe distance, avoid blocking exits, and do not touch unless required for safety. Respecting space helps residents feel less threatened. Fourth, offer choices. Choices provide a sense of control. Offer two simple options using calm, clear language. For example, would you like to sit in the living room or your bedroom? Choice reduces power struggles. To maintain a supportive environment, ensure safety by removing hazards and calling for assistance. Use a gentle and empathetic approach, avoiding blaming or arguing. Residents are having a hard time, not giving staff a hard time. DSPs must avoid raising their voice, arguing during escalation, making demands, or taking behavior personally. Calm behavior, respectful listening, and simple choices prevent escalation and keep everyone safe. The final section covers prevention strategies, including structured routines, environmental modifications, and proactive support. Techniques involve using visual aids, offering engagement, and providing Prevention is key. The best way to manage behavior is to prevent escalation before it starts. This supports resident safety, emotional well-being, a calm home environment, and fewer incidents. Structured routines mean following predictable daily schedules consistently across all shifts. This reduces anxiety and confusion, helps residents know what to expect, and creates a sense of safety and control. Environmental modifications involve adjusting the setting to reduce triggers, such as lowering noise levels, reducing clutter, or providing quiet spaces. A calm environment reduces overstimulation and promotes calm behavior. Proactive support involves anticipating needs before behaviors occur, such as offering a break before frustration builds, or checking for hunger or pain. This prevents behaviors instead of reacting to them. Practical prevention techniques include using visual aids like schedules or picture cards and using simple, direct instructions. This helps residents understand expectations and reduces confusion. Provide regular engagement and socialization through planned activities and one-on-one interactions. This reduces boredom and isolation, which are common causes of behaviors. Finally, offer positive reinforcement by praising appropriate behavior and acknowledging effort. For example, "You did a great job using your words. Thank you." This encourages repeat positive behaviors.